campaign, which I'm going to be talking today. I will start that talk by just playing this little video so everybody can watch.
Good morning, Doctor. Good morning. Please, can you introduce yourself and tell us what exactly are you doing right now?
I am Dr. Songani. I am an obstetrician gynecologist from the Kumba District Hospital. I am also here as the coordinator of the medical team. So right now I'm setting up my workstation. My workstations involve, of course, my consultation. I have to consult some people and listen to their problems and examine them and find out what they're looking for. But I will also be running the mobile ultrasound clinic. So I will do mobile ultrasound for those who need echography, they call it echography, to be able to make diagnosis for my other colleagues who need the results. I will also be doing chemocoagulation on this station. That is, those who have low-grade lesions from cervical cancer screening, you can come right to my workstation for treatment. It's an office procedure that I do right here. I have my assistants who assist me. They are preparing the other equipment. And we also, those who have high lesions from cervical cancer screening, we are going to arrange 90-day follow-up with their treatment. But those who have low-grade lesions will take treatment today as the fastest. It will be a one-stop shop. So what we can settle, we settle immediately. We are not going to make further.
Okay, thank you so much, Doctor. Good luck.
Okay, medical doctor and a public health specialist. Administrating all the interesting shows that we have here. Those are why I'm general cholera, and I also do general consultations and major services.
Okay, thank you so much, Doctor.
My name is Dr Ekokobe Fonkem. We are here at the the vital signs of the patient. So from here on, I need to triage.
Okay, thank you so much, madam. Okay, merci beaucoup, madame.
The patients on their part sat in a queue for screening by the nurses and the doctors.
Dr. Ekokobe, can you fast forward
I think
the
this is
video?
good enough. But the reason we showed this video was just a summary of what was jointly funded by Nukudo, Healing Beyond the Horizon, Life Bridge International, and the Fienga Poly Clinic in China. And how did all this come about? I just wanted to give a little introduction of who Healing Beyond the Horizon is. Healing Beyond the Horizon was created in 2009 as an organization to help to promote health awareness, healthcare awareness in Cameroon, poverty, and also nutrition, and as well as empowerment. And in 2014, Healing Beyond the Horizon undertook its first mission trip in the BLM division. And during that time, we went across the whole BLM from Adita Richard, Menji, and Azi, and even in Chad, where we saw about 2,000 patients over the course of 1 month. And during that time, we also treated diseases that range from waterborne, like dysentery, diarrhea, to high blood pressure, diabetes, and cancer. We repeated the same health fair in 2016 and virtually did the same stuff. But what we noticed was that the majority of the diseases that we're seeing during that time were diseases caused by waterborne, by sanitation, pretty much. At that point, we came back and we had a big fundraising. And during that fundraising project that we did in Texas, we raised about $100,000. And at that point, we wanted to embark in building a hospital but $100,000 was not enough money to build a hospital. So we said, what if we start by addressing the root cause of the problem, which would be building water filtration systems across the BLM as a way to have to remedy some of the waterborne issues. So that was when we reached out to Professor Zengung at the University of Georgia in Athens, who, because of that kind of collaboration, helped us to design a water filtration system which works through gravity. And through that water filtration system, we were able to implement a project like that in Atitovich, Upper Lowo, and even some around the region. So I can say that the villagers of those areas are now able to bring clean water, and we went back and did a research again, and the amount of waterborne illnesses has dropped. We were thinking to implement the same project when Cameroon, the BLM got into civil unrest. That made it so difficult for us to continue to do that work in the BLM because of the political instability. But while at the same time, our non-for-profit continued to raise money in order to finish building that hospital. And that project was made possible by Chief Wonya, who is sitting here today, who helped to design the hospital and also help us in supervising the construction of that hospital. But again, that hospital was also put on hold because of the political situation now in Anglophone Cameroon. So after spending about 3 years brainstorming on what we wanted to do, we reached out to Fienga Polyclinic and we spoke to Her Royal Highness Mamima or Mrs. Aston as she's called, and said, could we start a project which would be a non-for-profit trying to work together with a for-profit entity and working in order to help our own communities that have been internally displaced and now living in China. So she graciously accepted that offer, and we wrote a memorandum of understanding which was signed by both parties in 2021. After that memorandum of understanding, I was invited by the leadership of the Lukudo to serve on the health committee, and that committee comprised, was co-chaired by Dr. Roko and Dr. Tumbang Nyochema, and the liaisons on that committee were Dr. Abila Primos and Dr. Christella Mbebo. We're given the mandate to come out or to develop a health campaign to help our people in Cameroon. As a result of those collaboration between the Fienga Polyclinic, the Kudo USA, and Healing Beyond the Horizon, we decided that we're going to have a 3-day campaign in China. And that was a time when Library International also became interested and came to join forces with us. And I would say that that collaboration was great because we now were able to connect with Dr. Aswanyi as a lead, who also put together a team of doctors, nurses from the BLM and beyond, and along with Mrs. Asom from Fiengab and Library also bringing in their own representatives, while Healing Beyond the Horizon also brought in their own representatives back in Cameroon. During that health campaign, we're able to see, we're able to see close to 1,000 patients. And during that time, not only do we provide medications during that period, but multiple surgeries were also performed. Just a breakdown of that time, for the 3 days campaign, about 440-something men were seen, and 200 women were also seen during the course of that campaign. And the ages ranges from 1 all the way to about 100 years of age, with a median age of patients seen being around 40 to 50 years, followed by 0 to 10 being the second highest group of patients we saw. Most of the patients who were seen during this campaign had chronic diseases like diabetes, high blood pressure, and with a few of the patients having waterborne illnesses or cancer. And in terms of medications that were provided during that time, all the medications were provided for free by Healing Beyond the Horizon. And I went ahead and tabulated those medications, and the cost of providing those medications to the community cost Healing Beyond the Horizon close to about $30,000, with about $20,000 going for chronic disease medications, and the other medications provided by Healing Beyond the Horizons were for surgery. And at the end of that campaign, we also identified about 130 patients who had chronic diseases that were put on a 90 days chronic disease management cohort. And those are the patients right now that Healing Beyond the Horizon is providing medications, as well as doctors, nurses, and transportation to make sure that these patients are well taken care of. She also said that during the course of that campaign as well, we also conducted multiple tests. Some patients were tested for COVID, with a few patients with nobody coming up positive for COVID. We also screened patients for HIV, and some patients were positive for HIV who were referred for for continued management. We screened patients for malaria, and we're lucky that only a few patients were positive for malaria. We'll talk about surgery, so we don't need to go back to that.
2 more minutes.
How many more minutes?
2.
Oh, thank you. So, just to recap from this, I know early on in the morning we started talking about the 2023 campaign because the 2022 campaign got a lot of enthusiasm. So right now we have identified Mary Head of Africa and also the Finger Polyclinic as the 2 main sites where we're planning to go back for our next year campaign. At this point, we're currently accepting donations and volunteers who will be willing to undergo or to embark in this campaign. So if you are looking to be part of this project, please reach out to our CEO or reach out to any one of us so that we can get you, we can count on you for next year campaign. I think I want to thank everybody who made this project successful. I know that this is a kind of a project that will not be carried out by just one organization. I want to thank Kudo. I want to thank Libraries International. I want to thank the Finger Polyclinic, Healing Beyond the Horizon, and all the volunteers who all came to make this a success. I think I will end here, but I will be very glad to take any questions.
Thank you very much, Doc. I will give a chance for 1 or 2 comments or questions from the General Assembly. In the absence of any, we just want to thank you for your presentation. Initially built for about 20 minutes, we are glad you were able to do it under 10. At this moment, we will turn the microphone over to Professor Fonkem.